I was surprised to learn that so many industries that previously didn't have a drive to create direct relationships with their end users are now making it a top priority to develop deeper relationships with them. Enter the concept of the digital hub. This next session will help us understand exactly what hubs are. We are so privileged to welcome our next speakers to the stage. Leading this discussion is Nate Bayer, the Managing Director and Partner from BCG Digital Ventures. Let's welcome them to the stage.
Hey everyone, Nate Bayer. I'm a partner with BCG Digital Ventures. We are the innovation and incubation arm of the Boston Consulting Group. I'm part of the core healthcare leadership team. Healthcare is actually our largest sector in North America for digital ventures, so it's a big part of what we do on a regular basis. I love that stat about technology connecting with providers. And I think back to what Vinod Khosla wrote in 2012, which is that technology will replace 80% of what doctors do. And I think that was largely misinterpreted. People often took it as 80% of doctors are going to lose their jobs. And there was this gold rush around, go to the patients, it's consumer first. And that largely has failed. That hypothesis has been disproven. I really like what Charlie was saying in the last talk too. It's really about this nexus between not just that consumer experience, but also clinical outcomes. And now, I just read a stat, 84% of Fortune 500 companies actually have a health capability now. So you're really seeing that the world is moving in this direction and really trying to understand how to put all those pieces together. So what I'm excited about with this panel is we've got three very different perspectives. And what I was saying to this group beforehand is I'm hoping that we get a little bit of tension here on stage and with these different perspectives. Everyone's trying to solve the same problems around consumerization in healthcare. Alexandra Wilkes-Wilson is the SVP, I gotta make sure I get everyone's title right, SVP of Consumer Strategy and Innovation at Allergan and leads Project Moonwalker, which is really about driving consumer engagement within the Botox franchise and operates almost like its own startup. Leave that to you. But she has an amazing career coming from the tech startup world as a founder of Gilt Group, Glam Squad, and Fits. I think of Alexandra as that rare talent that all of healthcare is trying to hire in but hasn't quite figured out how to do. John Roselli comes from Bose and leads the newly formed Bose Health division, which is really exciting. John's perspective is coming from consumer electronics. He's got 30 years in product and business on the consumer electronics side, and we'll really be able to talk about how consumer electronics is moving into health, and you guys are working in sleep and hearing. And Susan Tu is the AVP of Consumer Digital Solutions for Intermountain Healthcare, and is here to represent that provider perspective. I think of Intermountain as really one of the leading players when it comes to digital innovation, particularly with what you've done with your patient portal, where Susan was able to drive 500% growth in accounts on the patient portal, and now more recently is focused on the digital front door that you're building there. So, and Susan, I'd love to start with you. Everyone's talking about patient empowerment. It's a hot topic these days, and I talk about a lot of patient empowerment, which is not every project I do as well. But what role does the patient actually play in their own care?
I shared with Nate ahead of this. I was so pleased I got the empowerment question because I've been about 15 years on the front lines working with providers, with our patients, with our caregivers, and as a patient myself or a consumer of healthcare services. My journey inside healthcare is not that empowering. I think it's probably similar to yours. Typically, it takes me about 3.5 weeks, if things work out well, to get in to see my physician. I wait about 40 minutes in the waiting room, and then I'm shuffled back and have a few minutes with a medical assistant or a nurse, and then finally I see my physician. But I actually can't see him because there's a monitor, typically between him or her and me. And as a result, he can't see me either, and isn't able to sort of read how I'm interacting and how I'm listening and how I'm really taking in the information that he or she is sharing with me. And oftentimes, about half of it is in language I don't recognize. And of the other half, I'm just hoping I can remember it once I get outside the door and prepare to go forth and be empowered in helping maintain or improve my health. But I feel anything but that. And I share that story because I suspect all of us have experienced that. Healthcare is daunting, that ability to try to access and engage. And at Intermountain Healthcare, what we've said is we have to change the way we do things. And it's important when you think about placing the consumer at the center, because historically we've had our physicians at the center. But I can't, in the delivery of healthcare through technology, ruin the physician and serve the patient. It's got to be a win-win for both sides. So our focus and our research and really what our emphasis has been on is understanding and meeting the patient in their life journey, not in that 10 minutes where they've got a face-to-face with their physician, but as they engage across the lifespan, trying to reach out, connect, and provide the kinds of services that we think are what they need, but making it easy for them to engage with those services so we remove the barriers and reduce the friction. And I oftentimes use the example, it's time for your mammogram, Susan. I got the letter. I do need to schedule. I'd love it if I got a text with click here to schedule. Online scheduling would be ideal, but a phone number would be fine as well. Or I think about this opportunity I'll share my calendar with you, I say to my physician. They see I've got an hour available on a Tuesday. I get a text. Could we schedule you at a clinic a few minutes from where you work and think about ways in which we can, again, remove the barriers, reduce the friction, and really empower you to take charge and control of maintaining and improving your health. That's really where our focus is these days. Mm-hmm. And I would also add this, it's not that we aren't trying. Healthcare tries really hard. Physicians are here to serve patients. That's what they love to do. But we really have to think about the model in which we have historically delivered healthcare.
Yeah, and it's interesting coming from the provider perspective. Alexandra, can you talk to, coming from the farmer perspective, how should patients engage in their own health, and what are you building to enable that?
Sure. So Allergan has the leading portfolio in medical aesthetics, and what Project Moonwalker has set out to do, based in New York, is to provide consumers with education and access to medical aesthetics, and to not only our portfolio of products, Botox, Juvederm, Cool Sculpting, Skin Medica, Natrel, the list goes on, but also just to educate them in general. So we launched 3 ventures within Project Moonwalker. The first that we launched is called Spotlight. Hopefully you'll check it out if you're interested in learning about medical aesthetics and beauty. Thespotlight.com, and it's spelled L-Y-T-E, and it's unbranded in pharma speak. So we don't actually talk about our drugs and devices, we just talk about really all kinds of beauty, skincare, medical aesthetics, questions, concerns, procedures. We interview doctors, experts, celebrities, influencers, and really have hired people from outside of pharma to bring their perspectives from media, tech, beauty, et cetera. And Spotlight's really all about education. Our second venture that we launched is called Regi, short for regimen, and that's all about giving our consumers, potential consumers, access not only to medical aesthetics procedures, but also to beauty treatments and services. Right now it's in 3 markets. So what Allergan did from a pharma perspective, and I'm very grateful to BCG because they brought me into Allergan as an outsider with a very different mindset and experience. I had never worked in healthcare before joining Allergan 2 years ago. The idea was really to take perspectives from technology, from the entrepreneurial landscape, from beauty, et cetera, and to apply what's really pretty standard and obvious thinking in tech and startup mentality and apply it to a world that has been much more conservative in terms of how digital has been embraced.
And John, could you talk for a minute? I love this tee-up of thinking about patients through the lens of what tech does, anyways. Could you talk about what it means to create stickiness for a product and how Bose thinks about that?
Yeah. So I think what's interesting here is that we're coming from a different perspective at Bose, right? So we're an audio company, audio entertainment company in cars and homes and venues like this, and so we've always thought about it as sort of the end consumer, and now we're thinking about it in terms of the end patient. How do we make it so that the product is easy to use, the overall user experience is great, You just basically take it out of the box. You don't even have to read anything. Within seconds, within minutes, you should be able to use the product. And we're taking that approach from a sleep and a hearing perspective. And so we've been around for 55 years. That's basically in our DNA. We sort of know that. The other piece that we don't know, though, is really trying to understand, and we've been humbled by this in terms of that there's other customers in the value chain, the patient, the provider, the healthcare providers as well. And so we've had to learn a lot of that and then figure out how we're going to bring that together. But I think specifically is we're combining not just the digital application, but also hardware as well, and putting those two things together. And as the prior speaker spoke of, giving patients something that truly adds value, something that you couldn't get anywhere else. And so not trying to gamify it, per se, from a sticky perspective, but just give them something that can help them, as you already pointed out, help them hear better or sleep better, and where they couldn't get that anywhere else. And that's sort of our way of making it sticky.
Susan, how do you think about how this notion of stickiness or optimized UX or just applying sort of tech principles, how could this actually help when it comes to clinical outcomes?
You know, we have decades of outcome data. We know what we've done historically, and we know what it leads to. So what I get excited about is thinking about the ways in which technology is going to help us up our game. And certainly want to meet all of the mandated measures that they place on us in healthcare. We absolutely want to drive those kinds of outcomes. But I think that the use of technology and that ability to engage in a way that is meaningful and that is easy, those are my two standards for provide me with value and make it easy for me to engage. I think we've got a tremendous opportunity to really hone in on all kinds of measures that maybe we haven't historically even thought about. So it's something we're keenly aware of and really, really focused on. We really do want to understand is the ability to interact digitally with that consumer across that lifespan. Can we really make a change there? That's ultimately what we're all about. And I think there is just a tremendous opportunity here.
And so, and this is a question for the group, because I think we're all solving the same problem in different directions. Start with the consumer, turn them into a patient. Start with the patient, turn them into a consumer. Start with outcomes. Could you all reflect on where you see differences in these perspectives, or the pluses and minuses of each different approach?
Yeah, I think that there's an opportunity to complement. Certainly you got to understand and work closely with the payer provider, because I think a lot of tech companies think that they can go in and disrupt and change everything, and there's a system in place, and you're not going to change it that quickly and disrupt it that quickly. And so you have to kind of work with some of the pieces that are there, like the payer provider, and I think that's really, really important. We're working on sleep, and our goal is to become a replacement for benzodiazepines, a digital benzodiazepine. But that doesn't mean that we want to actually disrupt the pharma companies. We actually want to work with them because there's times when a sleep drug, Ambien, Lunesta, might be the best thing for you, but there might be times when you could use a digital therapy. And so I think it's important to basically understand and seek out partnerships and help and understand exactly how you might complement each other to truly give the patient the outcomes that they deserve.
I think for our perspective, so I've been completely focused and obsessed with the consumer for the past 15 years of my career. I live and breathe consumer and always put myself into the consumer mindset, even if I'm not personally a consumer of a product. Pharma, from my 2 years in it, and you're all probably way more experienced than I am, but the fact that the word customer doesn't actually mean the patient or the consumer, and that the word customer means the healthcare provider, to me and to the majority of the team that I hired who had not worked in pharma before, they were all like, wait, customer means the doctor? It was very foreign to all of us outsiders joining pharma, and of course, quite obvious to people who've been in healthcare. And so that notion of course, the healthcare provider is so important to a pharma company, but obviously so is the consumer and so is the patient. And so everything we do within our kind of consumer digital team is really trying to marry the two and bring them closer together. And a lot of it starts with education and access. And for something like medical aesthetics, for many for many consumers, they're curious about them. We have data that shows 65 million consumers in the US are curious about medical aesthetics, but they don't know where to begin. And it's scary, it's daunting, it could be potentially embarrassing for them to ask their friends and family, although stigmas have certainly become very decreased. So bringing customers and consumers together, I think, is really important.
Yeah. Yeah, I love your point on nomenclature too. 100% of the DV projects we do, we have to spend a week talking past each other. Yeah. I mean, like product manager means a totally different thing, probably even within all your companies too. Okay, so I want to shift gears a little bit and talk about the how. Let's go down the line here. In what you're building, who owns the data?
It's a combination. I think the consumer should own their data. We also have a large 6 million person database of our loyalty program, which is called Brilliant Distinctions, and it's undergoing a huge overhaul. It's going to be so much better than what it is. But so we certainly have access as a company, have access to the data, and the physicians have access to data, so everyone has access.
Okay.
Yeah, I think what I can speak for is the Bose Health side, not so necessarily the Bose consumer side, but the patient or the customer will own the data. And we're going to make it really easy to either opt in or opt out, right? Right from the beginning of the opening screen on the app. You don't have to read any mouse type, and it's really very simple. And if you opt in, then we can personalize the experience for you. If you opt out, there's only so much we can do with sort of aggregated or longitudinal data. And we've made it a point we're not going to monetize the data, right? So we're going to make sure that the consumer owns the data because I think we're a very trustworthy company. We don't ever want to trade on that.
Mm-hmm. Yeah, we are in total alignment. That data belongs to the customer, the patient, the member. But with that comes obviously consent inside healthcare. And so I think that we all have a tremendous obligation to have real rigor around the way we manage that data and make certain that it's protected and managed in a way that is appropriate. But it is absolutely the patient's or the consumer or the member.
So building on that, Susan, could you talk about the system implications for that type of decision? And it's one thing to say, check the box that I consent, but it's another thing to actually put the data somewhere that it's accessible, deletable, manageable. Could you speak to that?
Yeah. Yeah, that's such a hard question. And here's the thing, it's, anything is possible technically, but surprisingly, I'm sure you've all experienced this, the operational lift to ensure that all of those boxes have been checked and it's being consented or managed or handled in the right fashion, it's a big job. It's a big job, and I don't say we get it right every single time, but I know we put tremendous rigor into the way in which we're making certain that on that back end we are managing as we should be from a compliance, a regulatory, legal perspective, and so on and so forth.
Yeah. Alexandra, could you jump on the compliance thing for a bit? And this wasn't in our planned questions, but we've talked about it on the side. Could you talk about, a lot of, from a process perspective, what it actually takes to pull that off within your non-tech startup world anymore of being within a corporate environment?
Yeah, well, one of the things that our team has done, and what's great is that it's permeated through other parts of the organization, not just the aesthetics division, is that in order to really play in social media, which we as a company have made the decision that we want to, of course, every single thing that we publish and put out there has to go through intense medical, regulatory, legal, and compliance review processes. And the people in place to do those processes 2 years ago when we started, we just didn't have that many people there, and they were used to reviewing a certain amount of content over a certain period of time. Now, when we launched a media site called Spotlight and wanted to have a social media kind of Instagram handle that was very active, that meant that there was daily reviewing of content, huge amounts of content. We have a big editorial team. That meant we basically had to overhaul our entire system, and so we got a medical, a legal, a regulatory, and a compliance person, headcount, dedicated to our team, sitting with our team, so that they are completely there in the trenches. And I was mentioning even real time. We publish content about the Golden Globes, and I never, when we started, thought we would ever be able to publish close to real time just because the review processes are so intense, and we did. We came out with really awesome content the evening of the Golden Globes. So we had to adjust and be patient, and for some of us who like things very quickly in a startup mentality, we had to understand why the processes are there, and once we could understand them, we had to make adjustments, and we did.
And John, how does, building on that answer, how is it different in your world, where it's a world where there's more hardware involved, and your processes come from the consumer angle, and what, in terms of what you're building in the health?
Very similar to what Alexander mentioned, which is that we've had to put together that team of people to review all of the collateral, right? Because from a compliance perspective, as we do FDA-cleared hearing aids and things like that, and working on clinical things for sleep. What we've done is we created a division to do that and try to put a ring fence around it, but I can tell you it's not without its challenges, and there's certain things that sort of leak out, and our compliance people are always pulling their hair out, sort of trying to make sure that we can follow those kinds of compliance, because it's easy to sort of fall back to sort of the consumer side, where, as you just mentioned, from a social media perspective, you can just blast stuff out, right? You don't have to really look at it, look for a compliance perspective. So it's a constant challenge. We haven't figured it out yet, but the best way to do it right now is sort of just try to, as best we can, put a ring fence around the business and try to self-contain it.
Yeah. I could say, coming from the side of working across companies, I've seen it multiple times, and it's different and difficult every time. And even recently talking about submitting for an IRB, IRBs are used to basically a PDF with a bunch of snapshots of whatever you're going to say, but that doesn't necessarily reflect a UX, right? And the UX is something that needs to be experienced, and I see a lot of companies struggling with how they actually assemble these, and it's a real lift to get there. There's a lot of work to actually figure all that out.
No question.
So, reflecting as a group, something came up earlier. It was on, partnerships, I think, and sort of how do you bring these perspectives together? I'm curious how each of you are thinking about, working across the ecosystem, and where there is value in working with different stakeholders and how they get involved in your processes, whether early on in terms of developing a product, or whether it's more sort of launching and pushing things out there longer term.
Yeah. Yes, I could talk to a couple that we've done. Obviously, being from Boston, there's opportunities we're working with Mass General and Brigham. But we've had a strategic partnership that we inked over the summer with the University of Colorado Health, not just to be a clinical opportunity to do work, but also to work with them strategically, and then also bring in United Healthcare as well, so sort of make it a three-way, so we can bring in the clinical side, the payer side, and then of course the manufacturer as well. And that so far is working out quite well, but I can't say that every single relationship, every single partnership we have starts out well, but then sometimes always doesn't finish well.
And how does that feed this, collision between clinical and consumer experience? How does a partnership actually enable that?
So the partners that we've partnered with are all really on the clinical side, right? And so I think that they've done a good job of helping us navigate, as well as some of our own people, clinical affairs people, to help with that. And so I think that's the way we've been able to balance that out.
It's just more like shared voice in the room.
Exactly, yeah.
And Susan, how are you thinking about that?
Well, I love the fact that I've got two panel members here, that it would be fun to talk offline about this as well, because as a healthcare delivery system, we daily have multiple opportunity to think about ways in which we might partner to deliver services around sleep, for example. I think the big collision that we frequently see is the experience side of it. And Intermountain has been, on the forefront of thinking about digital innovation, but we've overwhelmed and confused our consumers with a multitude of apps that we've stood up and asked, here, download, and here's how you manage this piece, here's how you manage that piece. So if we're crisp in understanding what our strategic objectives are, and we're very focused and really disciplined in thinking about who are the people out there that we might partner with, our goal is to create, we call it our digital front door, but sort of a door you enter and engage in one location and one way with the consumer, rather than a multitude of ways. And we are in the midst of building, or have completed, and we're in an MVP state as well here, with a product that we have in pilot, a platform that is going to allow us to whether it's a homegrown solution, something we've custom developed, or a vended out of the box, create that seamless experience that we think is ultimately going to serve the consumer and serve our caregivers and our physicians as well.
Yeah. Alexander, do you have anything else to add on?
Well, Allergan partners with so many different types of companies and individuals, but from Moonwalker's perspective, we've done a number of really cool and innovative partnerships with different consumer-oriented companies like Goop, and then really with key opinion leaders. So one of my favorite collaborations, partnerships we did was with a dermatologist in New York named Dr. Michelle Henry. We had her live for a few hours on Spotlight answering one-on-one private chats with consumers, and it was a test, it was an experiment. We had no idea how engaged the audience would be, and she got flooded with hundreds and hundreds of questions in a very short, or thousands, I should say, of questions in a very short period of time, and that was exciting. I think it just shows this thirst for answers by consumers to experts.
Yeah. Well, I think what's really interesting is everybody's coming from a different perspective, but there are some really consistent themes here, right? The value of UX alongside clinical outcomes, patients own the data, partnerships matter for getting share of voice and for creating new features or ways to engage. And I think what's interesting is all those themes matter across really different businesses and really different things that each of you are building. Thank you all for joining. Appreciate your time, and everybody enjoy lunch. Thank you.
Really interesting.
Thank you guys so much.